Have you ever heard of a process called ligamentization? My name is Michael Falk with Kinetic Sports Medicine and Performance, and this concept of a ligamentization is crucial in key reconstructive surgeries like Tommy John surgery or recovery from an ACL. So this concept of ligamentization is essentially that in these major surgeries, we are taking a tendon and then over time it is having to turn into a ligament. So we're taking a tendon. In the case of ACLs, most commonly we're either taking your hamstring tendon, your quadriceps tendon, or your patellar tendon, and we're substituting that in and reconstructing your native ACL, which is a ligament, out of this tendinous tissue. In the elbow with Tommy John injury, we're either going to use a little used tendon in your wrist called the palmaris longus, or we're going to use a graft typically from either your groin or your hamstring to reconstruct the ligament on the inside of your elbow. So why is this important? Well, tendons and ligaments do very different things. They're both passive structures, but tendons connect muscles to bones and ligaments connect bones to bones. And so with a tendon, it's actually a very important part of human explosiveness and elasticity, or kind of using the stretch shortening cycle. So if you think about taking a jumping action, you're going to be able to jump much quicker if you go through a full counter movement and jump up versus if you were to go down very slowly, pause at the bottom, and try to jump. The difference in those jump heights is essentially using the stretch shortening cycle, which is energy that is stored inside a tendon and then released to help improve speed or explosiveness over time. So that is what tendons mainly do and what their main function is. With ligaments, they are not really meant to be stretched. They are meant to connect these bones to bones and provide passive stability. And they're not really going to be contributing to storing and releasing energy over time. They're going to be solid and trying to prevent movement and shifting and keeping those joints congruent and in shape and moving well. And so over the course of your rehab, that tendon that was used as a graft is now having to go from being a tendon and having these kind of elastic stretch shortening processes, characteristics and processes, to becoming a ligament and being a little bit more stable and connecting those bones to bones. Why that's important and where that factors into your rehab is throughout the initial phases, there is a time point that your graft is actually going to be getting weaker because it's going to be going and getting remodeled and kind of broken down and turned into more of this ligament type properties and less of this tendon properties. Where that gets to be something that you have to be aware of is sometimes as you are starting to feel the best in the middle stages of your rehab, where you're not having the postoperative pain, your muscles are working better, you're not having as many range of motion restrictions, is actually where your graft is getting structurally at its weakest because it's getting broken down and it's going to be going through the process of getting rebuilt and molded more into the characteristics of that tendon. So it is this interesting time within your rehab that we want to be progressing, we want to be doing more advanced things, but we need to be cautious that structurally sometimes that graft is actually at its weakest point right in those phases as it's starting to go through this process over time. So this concept of ligamentization is not bad, it's not good, it's just something that happens. It is important in the overall end result of your rehab to have this strong, sturdy ligament that was reconstructed. It is just something to keep aware of as you go through this rehab, and that sometimes just because you feel great doesn't mean that you're ready to do some of these higher risk things, because the graft itself might not be ready to handle some of those stresses, and we need to be patient and allow that graft to heal and get strong and really turn into that ligament process. So when you're going through your physical therapy or talking to your doctor and they're asking you to be cautious and even though you feel good to not do certain things at that point, that might be why, is because they're concerned about kind of where that graft is at that healing state, and they want to make sure they give it enough time. So if you haven't heard of this concept, hopefully this helps explain that to you and gives you a little bit more background on what's actually going in at that reconstructive surgery site.